Hi, my name is Bishra Hassan, and I'm going to be speaking about thalassemia. So, thalassemia is an inherited blood disorder, which is caused when the body does not make enough protein, which is called the hemoglobin. When the body does not make enough hemoglobin, the red blood cells don't function properly and they last shorter periods of time. Thalassemia is caused by mutations in the DNA of cells that make hemoglobin, and there are two types of chains of thalassemia, which is the alpha and beta thalassemia. The alpha thalassemia depends on the number of gene mutations you inherit from your parents. Meanwhile, the beta thalassemia depends on which part of hemoglobin molecule is affected. So 5% worldwide population have been affected by thalassemia. It is usually common in the tropical and subtropical regions of worldwide. As you can see in the diagram below, um, in the Southeast Asia, Indian and Chinese Filipino descent have been affected by the alpha thalassemia. Meanwhile, in beta thalassemia, it is usually affected by the Mediterranean, Asian, and African descent. Okay, so thalassemia is usually, it affects your bone deformalities. Thalassemia can make your bone marrow expand, which causes your bones to widen. This can result to abnormal bone structure, especially in your face and skull. As you can see, as the image of the girl, like it gives you unusual bone deformalities. It can also affect your spleen. The spleen helps your body fight infections and filter unwanted materials such as old and damaged blood cells. Thalassemia is often accompanied by the destruction of a large number of red blood cells. This causes your spleen to enlarge and work harder than normal. It also, um, anemia can both slow a child's growth and delay puberty, and it could also cause heart problems. So some symptoms of thalassemia could be paleness, fatigue, shortness of breath, lack of appetite, dark urine, jaundice, which is yellowing in the eyes, delayed puberty, deformalities, as discussed as a previous slide, and abdominal swelling. And as you can tell by the graph, the mortality rate has decreased within time of thalassemia due to artificial intelligence and all different types of testing. Some diagnosis for thalassemia, usually it is tested with blood tests, and DNA testing help doctors identify which genes are missing or damaged. Um, Usually you don't need to get treated for thalassemia if it's mild, but if it is severe thalassemia, then you would have to do frequent blood transfusions, which is a transfusion that helps you give healthy red blood cells with normal hemoglobin. Um, there are also new AI devices that help you with transfusions, which is iocletian, which is the removal of excess iron from the body. And another treatment, if you do have severe thalassemia, would be stem cell transplants. That is the end of my presentation. Hopefully you guys learned something new and I gave you guys enough information about thalassemia. Thank you.